Diabetes can cause problems during pregnancy, not only for the mothers, but for their unborn babies as well. Dr. Devon Ramaeker, St. Luke's Maternal-Fetal Medicine Specialist, joins us to talk about the types of diabetes and how to manage their effects. Doctor, thank you for joining us this morning. I think we've all obviously heard about diabetes, but there's several different kinds. What are those types and how do they affect pregnancy?
Sure. So there are two main types of diabetes that we can see during pregnancy. One is called pregestational diabetes, which actually is the type 1 diabetes or the type 2 diabetes patients, or gestational diabetes, which is what occurs during pregnancy.
Well, doctor, what are women with pregestational diabetes at higher risk for during pregnancy?
Sure. So women that have pregestational diabetes, which again is type 1 or type 2, can have difficulty regulating their blood sugar in the first part of pregnancy. Not only that, but if they come into pregnancy not well controlled, they're at increased risk of miscarriage and birth defects. Moving forward into pregnancy, if they have any organ damage like eye damage or kidney damage from diabetes, that can get worse during pregnancy. They can also develop high blood pressure problems, have a baby that grows too large or not well enough, and actually need a C-section for delivery.
And what about the risks for mothers who then develop gestational diabetes?
For mothers that develop gestational diabetes, they also have an increased risk of things like high blood pressure problems, babies growing too large. Additionally, one thing that is often forgotten is that those moms have a high risk of developing type 2 diabetes later in life. In fact, about half of moms who have gestational diabetes will develop type 2 diabetes over the next 10 to 15 years after that diagnosis.
With gestational diabetes, is there any pathways that women should look to go down prior to getting pregnant?
Yeah, so for women with pre-gestational diabetes, we really encourage them to either speak with their endocrinologist or ideally with a maternal-fetal medicine specialist before pregnancy to talk about how to manage their diabetes before getting pregnant, so that they enter pregnancy under their best health, with their best care. For gestational diabetes, as we mentioned, that's something that you develop during pregnancy. So that's not something moms can plan for beforehand.
And when should patients come to St. Luke's Diabetes and Pregnancy program?
So they're really encouraged to come at any point in pregnancy. Again, for moms with type 1s or type 2 diabetes, we would love to see them before they achieve a pregnancy when they're thinking about planning a pregnancy. If that does not occur, we're happy to see them really at any point. The earlier, the better. And with gestational diabetes, as soon as they have that diagnosis, which is typically in the third part of pregnancy or the third trimester, we'll see them at that time.
Dr. Ramaeker, thank you for your time this morning, all the great information. To learn more about St. Luke's program, which includes dietary counseling, glucometer training, ongoing blood sugar assessment, and medication management, go to stlukeskc.org/diabetes in pregnancy.